Thank you, everyone, for sticking around for our final session, and I guarantee you will not be disappointed. Joe Kennedy is the perfect closer for us because he's cared about health care for decades. When you were in Congress, he wrote first opinion pieces for STAT. You've focused on Medicare, Medicaid, universal health care, Social Security, mental health, drug addiction. These have all been your issues. And you've also had a front row seat to the politics going on, including in your own family. So we have a lot to touch on.
Can't wait.
Yeah. So let me just, there's so much to talk about, but let me just, if I may, get right into this. Because we've talked over time about what's going on with your uncle and RFK Jr., and you've been very careful and understandably, and something I respect about not piling on and sort of worrying about the family reputation and all that, and just careful about sort of how you could make a difference. But then after we agreed that you would come here, we had him, he testified at that Senate hearing, and I think you could not help but on Twitter or share this about your uncle. Robert Kennedy Jr. is a threat to the health and well-being of every American. A United States Secretary of Health and Human Services is tasked with protecting the public health of our country and its people. You said that he's done the opposite, dismissed science, misled the public, et cetera, et cetera. And then you went on to say, none of us will be spared the pain he is inflicting. It doesn't matter how rich or how powerful you are or what state you live in. The heartbreak of watching a loved one fall ill knows no borders. The challenges before us, from disease outbreaks to mental health crises, demand moral clarity, scientific expertise, and leadership rooted in fact. These values are not present in the Secretary's office. He must resign. That's pretty powerful and direct. Given how careful you've been about speaking out, what led you to that moment? And you don't really need to tell us how you really feel because we see it in that statement.
Rick, first, thanks. Thank you all for being here. Thank you for your participation in the summit. Thanks for sticking around on Thursday afternoon. I guess I would say, Rick, a couple things. One, the statement I think was, as you alluded to, I think pretty clear and direct. None of this aspect of what's going on in our country, particularly with regards to our healthcare system, is particularly fun for me. And I know it's not fun for a whole lot of people for probably much more serious reasons than mine, right? But for a family that's grown up in a public life, we'll all have our differences, as kind of big families will have. We have, for generations, done our best to kind of keep those disagreements out of the spotlight. I think what motivated that statement was what a series of decisions and actions that many of you know as well as I do that have led to the point where I've got grave concerns about the safety and integrity of our health system, and we need to change. And I can't say it much more clearly than I did then.
What's your can you shed any light about what you think is going on here in the motivations of our leaders, whether it's Kennedy or Trump or Bhattacharya, any of these people? We've talked about all these in the last 2 days and what's going on, and trying to understand what's happening at the NIH and the FDA. Who do you, point the finger at? Is it all because Trump's president and he brought this on?
I mean, you guys have heard from doctors that are far more better qualified to get in their heads than I am, right? What I can say is taking like a big step back and just kind of drawing on my time in politics. For decades, I think there has been a thread through a Democratic Party when it comes to healthcare that this is something that everybody needs. Whether you're bringing a new baby into this world or watching a loved one pass through it, you get hit by a truck walking across the street, like we all are going to need a healthcare system at some point. And so, you know, we're in a capitalist society, things are unequal, things are uneven, it's hard to deliver this stuff, but that if you're all going to need it, then it should be there when you need it. And so how do you then design a system that's there when you need it, as if you needed it or for you or your loved one? And that's a hard thing to do, and it's a complicated thing to do, but that's when I look back at the past 50 plus years about Medicare and Medicaid and CHIP and the ACA and various expansions here to try to do that. And that's kind of what animates it. I think particularly, it's always been a political issue, but you know, CHIP wasn't, and there's been plenty of support for many health programs from conservative side of the aisle as well. Really, I think, you know, the polarization that picked up around the Affordable Care Act and Obamacare, and I think you saw this certainly in the first Trump administration, where it was a repeal and replace, but there was nothing to replace it with. It was just repeal it. Well, okay, if this isn't what animates your idea around healthcare, what is the alternative? You don't like this, fine. What's the alternative? There wasn't one, and there still isn't one. It's just less. It's just cuts. And it's this idea that, oh, well, we can deliver it more effectively, efficiently if we cut $1 trillion out of healthcare for poor people. How? How are you going to do that? And there's no answer to that question because you can't. And so I can't, I'm the last person to try to get in the mind of President Trump or any of the healthcare leaders you mentioned, other than to say, I think to some extent it is a reflection of, you know, leaders in Congress of just saying, hey, we've been fighting against this Affordable Care Act thing for a long time. Here's our opportunity to squeeze it out or to gut it or to roll back those numbers. The irony, again, that you all know very well is, you know, should these premium increases be allowed to expire, should these premium subsidies be allowed to expire and these increases go up, it's going to be millions of supposedly, you know, voters in conservative areas in red states that are going to get walloped with not like a $50 increase a month, but 2 to 3, a doubling or tripling of their healthcare costs at a time when energy costs are going up, at a time when cost of living is going up. Like, there's thousands of dollars a month that are going to go on their bills that people can't afford. And the real question that I would love to ask President Trump on that is why? Why do you think that's a good idea as a policy standpoint to put on the backs of American families to say, you know what, in order to get access to the same healthcare you were getting today, you should pay $2,000 a month more for it? Because that's what's going to happen. And why do you think that's a good idea? And I haven't heard anybody explain that.
Is there anything that if you were back in Washington with the Democrats, anything Democrats aren't doing to sort of counter what you're, like, what would you do? Or is it like an impossible situation?
I think, one, I think they're in a hard situation, like, and kudos to my colleagues and former buddies there, or former colleagues and buddies there, that are trying to do this work. I do think that, to some extent, you know, Democrats love white papers. We love to talk about stuff we write in stat. We love to talk about regressions that happen in Stata. We love to talk about all sorts of fancy stuff that, in policies that impact people. What you lose in that is like how a regular person experiences the challenges that are affecting them. I was in the Mississippi Delta recently with some of the work that we're doing with groundwork, and Mississippi Delta, as I assume many of you know, it's an alluvian plain. It's the delta region of the Mississippi River. It's one of the most fertile grounds, fertile territories in America. It was for hundreds of years, area for huge crop cultivation. It is also, for many folks, a food desert, which is an interesting question when you sit there and go, hey, you're growing a whole bunch of stuff, and not all of it is food, but cotton and plenty of other things, but you're growing a whole bunch of stuff here, and yet it's a food desert. Why? Because many of the people that live there are too poor to afford fresh deliveries from fruit and vegetable wholesalers to deliver them to a grocery store. And if that's the case, how we experience healthcare, you don't need to talk about about what's going to happen from some regression analysis from, plenty of the academic institutions around here. It's just, how do you help your baby eat? And if you can't, why not? And why in the richest nation on earth are we still struggling to make sure that babies can eat in our country? And there are people in the Mississippi Delta that are working day and night to make sure that babies can eat. We were talking about this backstage, I'm a proud son of Massachusetts, as I think most of you know. I was always brought up believing, in part because of my uncle, Senator Kennedy, that the first community health center in the country was here in Dorchester, Massachusetts. I went down to Mississippi, and they were proud to tell me that the first community health center in the country was in Mount Bayou, Mississippi. And I was like, no, it's in Massachusetts. They're like, no, it's in Mississippi. So we got a big fight about it. I think they were right. Don't tell anybody in Massachusetts, right? But along the wall in the community health center in Mount Bayou, Mississippi, is a letter from Sergeant Shriver, then head of the Office of Economic Opportunity, to the governor of Mississippi saying that they were going to start this thing called the community health center, provide health care to people in rural Mississippi. And then there's a response from the governor saying, oh, no, you won't. You are not welcome. We do not want your money. Stay out. And then there's a response from Sergeant Shriver saying, too bad, we're coming anyway. And it's still up on the wall there. And they came. When there was resistance from local leaders, at one point we sent doctors to communities to treat people. Now we're sending the National Guard. Why?
Help me understand something, and that is, I don't know if you're able to
Doubt it.
get into the head of your uncle, but I need some help understanding this. We had Bill Nye, the science guy, at a STAT event not that long ago in New York. And he's usually sort of apolitical and so forth, but he got up on stage and said, what the hell are they doing to health in this country and science in this country? And then backstage, he talked to a bunch of our reporters and showed he'd become friends with RFK Jr. because they were in California. They lived nearby or something. And he started showing these texts over the years he was getting from them, and they were like rants and screeds about health. And then Bill Nye would respond, and then he'd do another screed that was very sort of indecipherable, on and on and on. I also, your cousin Carrie Kennedy Meltzer shared a physician in New York, shared with us at STAT a whole cache of sort of emails that he had sent her over the years that were very similar, like these long rants that were hard to understand. And I guess my question to you is, what's going on in his head, and how much is it based in science, or where does this come from?
So Rick, I can't say, right? And it's obviously a much better question for Bobby, for Secretary Kennedy. That's a question for him to answer. What I can say is, as I said before, right? I have deep disagreements about the way in which this administration is going about trying to strengthen, if you can call it that, the public health infrastructure in our country. Trying to get inside the motivation or the rationale, like I don't have anything else to add to that. Right? I don't know.
Has there always in other areas, is this familiar to you with him, or is this something new when these rants about health?
Look, again, Bobby's a member of my family. He's been I grew up with him. He's obviously quite a bit older than I am, but I grew up with him. I grew up with his kids. I've got great memories of our time sharing just family time and events and everything else together. When we were together, we talked about plenty of other things that wasn't public health policy. He obviously has gotten into that of late, but I'm not in a place to be able to comment on the details of that or his motivations beyond which he's stated publicly, and I've responded.
And that's totally fair, and I don't mean to over push you on it, because it's personal and it's hard. So I respect that. One other thing on that is when you called on him publicly to resign immediately, or he must resign, did you hear back?
I'm going to keep the conversation between me and him private on that regard.
Okay.
Thank you.
When you see, the other question I have about not just him, but Trump and the leadership in the administration, there's kind of some truth in what we're hearing from Washington, from Trump and the Republicans. It's hard to say, when we're doing stories for Stat, it's hard to say what RFK Jr. is saying is wrong. It's like, there's like some truth here and truth there, and sometimes he's trying to do the right thing, sometimes he's not. What do you make of how the public and how, I guess, the media and how people should be able to respond and deal with that kind of complicated, complex basis of information about health?
So look, I think it's hard. I think our country's struggling with this. On a lot of reasons that you all will know and have a probably more nuanced and sophisticated perspective on even than I, but the lack of trust in a national media ecosystem, the lack of kind of in a populist moment, lack of an animosity or a grading against expertise, a populist moment that we are in, the proliferation of social media, so you get influencers that are somehow experts on everything under the sun, even though, like, who knows why. But you're getting stuff to your pocket that's telling you certain things that I don't watch broadcast media all that much anymore because, one, I don't have time. I got 2 little kids, but 2, I catch the news from actually reading the newspaper, which is weird for some people, but like that's what I do. And
the actual print?
Mostly on my phone, but print too, right? And like, I know it like opens like this,
right.
Left to right, and the whole thing. But that's a thing. I do, bear with me for a second. One of the analogies that I often use actually might be particularly applicable to this crowd. But I do come back to the fact that healthcare is something we're all gonna need. And it's something that, like, I got 2 kids, so we need healthcare advice all the time. But I defer to my doctor because I don't know, right? Like, I whatever the doctor tells me to do, normally I will do because it's normally scratches and fevers and bumps and bruises. And so it's not all that something serious. If it were something serious, we'd go get a couple of different opinions, but I'm deferring to that expertise and to the expertise of one of the luxuries of living in Boston, of a broad medical community that can help crowdsource about, hey, this is what we think it is, this is the person you should go talk to. But at a certain point, you depend on that expertise. And I think people are still gonna depend on that expertise. The issue is do people have faith and trust in the source of that information? And how do you build that back up? And the example here, and again, bear with me for a second, I give this as political advice to everybody. Folks in this room ever seen the movie Patch Adams? Hope so. Great movie, thank you. Got one guy in the back. If you haven't seen it, great movie. Philip Seymour Hoffman, Robin Williams, 2 doctors. Robin Williams, most genius doctor ever, rubbing up against Philip Seymour Hoffman, who's supposed to be the smartest guy in the room. Fast forward, I'm going to spoil the movie for you, so sorry, but it's a great movie, go see it. Philip Seymour Hoffman has a patient, Betty White, the real Betty White, who, he says, look, I can outdiagnose every doctor in this hospital, but I can't make her eat, and she needs to eat. Will you, Robin Williams, help me to get her to eat? And as she says no, he then comes back and says, you want to help her eat? And the scene cuts, and she wakes up in a kiddie pool full of spaghetti, which, as far as I can tell, is not actually a prescription for anything. But what it is the difference between diagnosing and treatment. It's one thing to tell somebody what's wrong with them. It's another thing to say to them, I understand, I can diagnose what's wrong. I also can come up with a solution that meets you where you are that will actually help make you better. The medical field has done this forever, particularly in this town. We've got a beloved guy named Paul Farmer that literally pioneered a field of medical anthropology to say, hey, we can diagnose people, but if you don't provide some sort of cultural competency, cultural translation to be able to say this is what's going on with you, you can't convince them to actually take a shot in the arm. They've never done that before. How could you possibly convince them that's the right idea? What I think this country needs writ large, not just in the medical space and public health space, but politics, community level, we got to do a much better job of actually meeting people where they are, understanding what those concerns are, and then translating them. People are looking for answers. I mean, you're seeing that even in the current administration and the followers of that administration and the proliferation of these influencers. There are people out there, they're getting followers because people are looking for answers. They don't have them. They're concerned, they don't trust the answers they've gotten before, but they're still looking. So how do we adjust that system to be able to actually not reject the science, because the science is going to provide those answers, but build up the credibility such that people will trust what you're saying? And that's where the Democratic Party has gone astray. It's where a lot of our institutions have gone astray, and it's where I think a medical community writ large, it's a way in which we're going to rebuild back up this trust, even if you say you've got deep issues with this administration, and you need a new head of the NIH and CDC and FDA and every other health agency out there, CMS, et cetera, and HHS. You're not going to be able to re-legislate faith in these institutions overnight. It's not like all of a sudden a new leader there is going to say, oh, now I've got full faith in what they do. You got to rebuild them, but that starts with rebuilding that trust.
What do you say when you say people want to hear answers and how do you counter the President of the United States speaking before the American public and saying, do not take Tylenol repeatedly? What are people supposed to do with that? And how do you?
I mean, look, I think, one, it's hard to hold President Trump to account for much. Systems had a hard time doing that. Multiple systems have had a hard time doing that. I would remind this crowd, some of you remember he told everybody to inject bleach. I assume you guys didn't do that, right? So, one of the challenges here is he says a lot of everything. So it's kind of hard to hold them account when I always kind of smirk when people say, well, promises made, promises kept. It's like, dude promised everything. So, he kept some of those promises. He also made a whole bunch of promises he certainly didn't keep, right? And that war in Ukraine was supposed to be over on day one. Remember that one? Right? Amongst plenty of others. So, yes, it is hard to hold him to account. I also don't think, and I'm not a big MAGA follower, but I'm not sure even some of the most MAGA followers look to President Trump to provide healthcare advice. I think they look at him because he has been able to foster a connection, a deep connection, and a trusted connection with that base. But I don't think all of his followers didn't go and inject bleach the next day.
Right. But the difference, I think, for what it's worth, is people kind of inject bleach. That's nuts. People kind of rolled their eyes. But when it's very forceful, do not take Tylenol. It's a different, and repeatedly. I feel it's a little more of a command. But maybe I'm wrong.
So I defer to you on that, Rick. I think, one, I guess kind of we'll see. Two, I don't take Tylenol every day, right? I haven't stopped taking Tylenol when I need to, but I don't take it every day. And what would I do if I needed to? I would talk to a healthcare provider about if there's some specific need for Tylenol that I take it because I'm now I wake up in the morning and stuff hurts because I'm getting older and I've got little kids I'm trying to keep up with. But that's I think that's the way in which most folks take it. I'm not sure we've seen a major shift off of it. And obviously I think the concern that even the president was pointing to was issues for pregnant women. And I think there is obviously a real danger there, particularly if you can't take Motrin, you can't take ibuprofen. Tylenol is a concern, particularly if you have a high fever. You guys know all this stuff far better than I do. But and there has been some counter messaging about that. I think the issue here is I'm not, for the next couple of years, you're going to have a unconventional president that has been able to, and an administration that has figured out a way to dominate a communications landscape that is pushing stuff, their perspective 24/7, 365, particularly through social media, because it's all in our pockets every day. you have to counter that. But I will say one last piece. When I spend time doing some of our organizing work in Alabama or Mississippi or West Virginia, it's around here where you wake up every day and you walk into an office or you have lunch with somebody or breakfast with somebody and they say, did you see the latest press release, or can you believe what he did last night, meeting the administration? Nobody in Mississippi says that. Like, government in Mississippi has been against the people in Mississippi for a long time. Like, great, take a number. We're going to figure out a way to raise our kids. So they're figuring out a way to raise their kids. So find the folks that are figuring out a way to raise the kids and support them. And if you can help create summer camps where kids are going to be able to go and get fresh fruits and vegetables and see a nurse and get trusted medical advice. If you can do that in their schools, if you can actually help create an ecosystem there where healthcare and mental health can be delivered robustly and routinely, that's the way you're doing all this. You're not going to, the next head of the CDC, I think if you polled most Americans and asked them who was the last head of the CDC, they wouldn't know. So the issue here, where I think a democratic world can sometimes get askew, is the impact of the way in which these, the devastation we're seeing across the public health infrastructure is going to be impacted or felt by so many Americans. It is so attenuated, or it is so so far down that chain of actions that trying to make that case as to, hey, this person got fired and so, or this program got closed and so therefore this happened. If you have those doctors in a community health center that have been providing that work and that care to communities for years, if not decades, like, those patients will trust that doctor. I don't care what anybody else says, they're gonna trust that doctor. So you wanna do that? Let's actually flood the zone with doctors in these places.
Joe, let me ask you just very quickly, because I know we're out of time, but a couple things. One, on a positive note, in the MAHA movement, is there anything that you would compliment of what they're doing?
So look, I do think, and to give my uncle some credit here, trying to address the diet of Americans, to try to actually have people eat fresher food, healthier food, organic food, like, that's great. I wish him nothing but success that way. The effort that we heard from Dr. Taylor and others talking about, trying to, the extent to which they can and will, which I've got, we'll see, but are willing to. One of the biggest issues, I think, on mental health is stigma, and the issue to which you've got folks that are talking about it and will speak about their own experiences with it, and a genuine effort to address it. That's great too. I've got my issues about it, how do you do that and cut $1 trillion out of Medicaid? That's another issue. But, I am one of those folks that respects the outcome of elections, wish my president and my government success, understand that their definition of success might not be my definition of success. But my idea of success is trying to build a stronger, more resilient, safer, healthier America. And the extent to which they can do that, I do wish them success.
And part of that rebuilding the trust in scientific institutions, when I go back to your statement, Kennedy must resign. What would you, without necessarily naming names, but what, if that happened, if he took that advice, what would you do to restore? Like, is there any kind of person you'd put in place and change? Would you get rid of the whole leadership of health in DC? What would you do?
Rick, I would start by robustly funding Medicaid, which we have never done, ever. I would actually fund mental and behavioral health care the way in which we have never actually done. Huge sea change, as all of you know, about trying to have mental behavioral health care as part of an essential health benefits package under the Affordable Care Act and mental health parity. But when we say, hey, it has to be covered, but by the way, it's a 6-month wait to see a practitioner because Medicaid reimbursement rates are slow, that no one will take Medicaid in your state, that doesn't solve a problem, right? Like, it hasn't. So, let's actually fund it. I would try to peel back disclosures to try to make sure that we actually understood how much various states want to. I don't think I told you this story, and if you'll indulge me, when I was in Congress, I actually asked somebody at CMS, I said, can you give me the list of reimbursement rates, the reimbursement schedules across your states for mental behavioral health care? And the guy said, no. I was like, well, like, what do you mean no? And he's like, well, we don't have it. I was like, well, aren't you CMS? And he's like, yeah, and we don't have it. I was like, well, how do you not have it? And he's like, well, a lot of this is done by managed care, and so it's like a contract that is done from the state negotiating this, and it's proprietary in a black box, so we actually don't see it, we write a check. And I was like, okay, well, not for nothing, I sit on this committee. Can't I write a law that says you have to provide that information? And he laughed. And he was like, you don't get it. I was like, well, clearly not, but like, what am I missing? And he said, the reimbursement rates are so low that the moment you file that bill, every governor in the country is going to tell their delegation you can't sign it, because it is going to force them to take money out of education or other healthcare or public safety and allocate it here, because there will be such an outrage that, I mean, I had a friend whose mother was a practitioner in a southern state, and after she cleared her costs, the reimbursement rate for a counseling session was $6, $8. $8. Like, no. Like, doctors have student loans too. They're not gonna, they'll take a couple of Medicaid patients, but like, that was coverage. It's not coverage. And so, you know, my point on this is like, yes, the personnel matter, clearly. That matters more. Solve that problem. Solve the issue of why in an alluvial plain in the Mississippi Delta, the people are kept so poor that they can't afford fresh fruits and vegetables, so no wholesaler will provide the delivery other than Walmart. Solve that problem. And if we can take those challenges on to meet people really where they are, so that in poor parts of this country, and again, the summer camps and childcare the average cost of childcare in the city of Boston is $40,000 per child per year in the midst of an affordability crisis. It's more than mortgage payments. Provide summer for those kids with fresh fruits and vegetables and allow them to read and a nurse, and you will solve myriad problems. We don't do that. So rather than bemoaning like, hey, we don't know who that, head of a 3-letter agency that most folks in America have never heard of, like, solve the problem for that kid and that mom and that dad. And we should be able to do that. Like, scaling up summer camps can't possibly be that hard. So start there.
Final question. That is, and it's something that we asked earlier, so you're not alone here. In being asked this, when we talk about the threat to the health and well-being of every American, are you worried that because of these policies from Washington that a lot of people are going to die?
Look, I think without question, you take healthcare away from people, people are going to die. That's an obvious statement, right? You cut hundreds of thousands, if not millions of people off of Medicaid because of Medicaid churn, because you send a letter to an old address and force them to comply with a whole bunch of paperwork that they don't know how to fill out, or it's confusing or whatever else, and so they lose their health care, and so they don't get access to stuff, and all of a sudden they don't go to a pre-screening thing for colon cancer, which they could have gotten diagnosed at stage 1 instead at stage 3 or stage 4, and so people die. Like, yeah, that will happen. I mean, the data out there on that is like, I haven't seen that subject to a whole lot of controversy, like that's the case. And, the hard part is when you hear folks say, oh, well, we can't afford it. Like, we just bailed out Argentina to $40 billion. Like, we found money to bail out Argentina, and we can't find money to, like, insure America? Like, are you nuts? This is the most insane policy choice I've ever seen. But, there's a political question up to the American public to say, yeah, we actually value access to healthcare more than providing some financial bailout to Argentina because to support a far-right economic agenda, which, maybe America cares more about that. But Democratic Party has to make that case. You're in a government shutdown and you're building a ballroom worth tens of millions of dollars in the White House because he didn't like the way the East Wing looked, or the East Room looked. Like, that's fine. I was there, a year ago. It looked okay. It could fit a bunch of people in it. bigger than any room in my house, better curtains, right? Like, I don't know. I mean, is that the urgency of this moment, that we're going to build a bigger ballroom in the White House rather than provide fresh food for kids? Like, and by the way, if we can't hold them accountable on that, like, my God. Anyway, leave it there.
Joe, I appreciate your passion, your candor, and thank you for coming. Really appreciate it.
Appreciate it. Thanks, everybody. Good luck.
Thank you.